Welcome everyone to Mayo Clinic Q&A. I'm Dr. Helena Gazelka. Mayo Clinic has a long history of international medicine that began when Doctors Will and Charlie Mayo traveled the world as pioneers in medicine, sharing best practices and learning new techniques. Today, international activities are an essential part of Mayo Clinic's vision to cure, connect, and transform. Whether in the States or abroad, the international team serves patients from around the world. Joining us to discuss this today is Dr. Anton Decker, the president of Mayo Clinic International. Thanks for being here today, Anton.
You're welcome. Thank you for inviting me.
Well, it's just so wonderful to have you here today because I think that many of our listeners maybe aren't aware of the presence that Mayo Clinic has throughout the world.
I suspect that's true. We certainly do have a presence right now, and it's very much growing.
So Anton, we talk here about the mission to take Mayo Clinic to the world. What does that mean to you?
Well, if you think of Mayo's origins, from the very beginning, Mayo has been attracting patients from all over the world to come for a definitive answer, and very often people who have run out of treatment options. So it's in our blood. But as healthcare has transformed, and as we look to 2030, where, as you mentioned, cure, connect, and transform becomes so important in our strategy, we've had to think very carefully about, are there new ways in which we can take the Mayo model of care to more people in the world? The time has never been better. COVID aside, of course. Transportation is easier, communication is easier. We're more connected than we ever were. And frankly, I think we have a moral obligation to take the Mayo model of care, particularly as it pertains to serious and complex diseases, where you can find a definitive answer very quickly, or a cure, hopefully, or hope at least, to many more places in the world. And that's what we're doing.
It's wonderful. Anton, can you tell our listeners a little bit about the ways that Mayo Clinic International reaches patients?
Sure. So firstly, remember that in our Mayo Clinic US destination medical centers, that is in Rochester, Minnesota, Phoenix, Scottsdale, Arizona, and in Jacksonville, Florida, we attract patients from about 140 countries every year. And I always find it very humbling to think of what an enormous distance people travel to see us.
It's amazing.
We are making we are very aware and humbled and privileged that people will travel such a long way to see us. And we're working very hard at making that experience even better. Easier, better, faster, and helping them get to the definitive answer quicker. We've also accelerated our virtual capabilities, and we now do virtual visits all over the world every day. One can't help but recognize how this was accelerated because of COVID. We simply had to. Other than that, we also have a physical presence internationally. In Abu Dhabi, we have a facility called Sheikh Shabood Medical City that is well on its way to become Mayo Clinic's fourth destination medical center and a regional hub and referral center to treat people. We have a clinic in London that is growing every day and seeing more and more patients, including cardiology patients and soon to be gastroenterology patients. But even more importantly, it's becoming a gateway to many subspecialists in the US. We do many virtual visits from London in something that we call hybrid care. You can see a Mayo doctor in London, have a Mayo quality CT scan or MRI and laboratory test done, and then when necessary, have a virtual visit with a specialist or subspecialist in the US to try and find a definitive answer. We also have something called Mayo Clinic Network International, and that is about 10 and growing international healthcare facilities that have been very carefully chosen and meet our quality standards to form part of a global network. And the last thing I would say is part of my charge and our team's charge is to think of other dimensions and ways that we can take Mayo Clinic to the world. It's not all just direct patient care. We also provide thought leadership, help other healthcare organizations figure it out. How do you start a hospital? How do you implement a Mayo model of care? How do you achieve Mayo level quality? And how do you develop that special touch that Mayo has with patients? So that's just a broad outline of the many ways in which we're taking the Mayo model of care or Mayo Clinic to the world.
That's wonderful, Anton. One of the things that you said at the very beginning really struck me, that our patients come from 140 countries around the world. And I have to say that if I think about traveling to a foreign country, one of the things that would stress me out the most is if I needed healthcare and had to try to go explain to someone with a different culture and in a different language what I needed. And so I've always greatly admired our patients that I see in the pain clinic for having the chutzpah and the gumption to come here and seek care.
Yeah, I agree with you. Sometimes I like flying back to Rochester on a Sunday evening. And if you land in Minneapolis or in Rochester, you would typically sit on the plane or on the bus with patients that are coming to see us. And I like doing that because sometimes I talk to them and I find it very humbling. They've come from all over the world. And Monday morning, the lights go on very, very early in Rochester, and those wheels start spinning like nowhere else in the world to try and help those people. We're very privileged and grateful for patients coming to seek our care.
And as you were making the list, one other thing struck me as an educator here at Mayo Clinic, that one of the ways that we contribute internationally is that we train future providers and particularly physicians and scientists who come here or who we meet out where they are in the world. And I think that's an incredible contribution as well.
Very much so. And that's dynamic. I'll tell you how important that is to us internationally. One of the first senior leaders that we appointed inside of Mayo Clinic International is the Executive Medical Director for Academic Affairs, whose scope includes education and research. It's an integral part of who we are as Mayo Clinic.
Anton, you mentioned our work in the Middle East and particularly in Abu Dhabi, and I imagine that fascinates many of our listeners as it does me. We are right at the first anniversary of the medical center there. And I'm wondering, what successes have you seen over the last year, and what does this joint venture mean for our patients in the Middle East and beyond?
Elena, when we decided to go to Abu Dhabi, the biggest discussion and decision that we made was that we are not simply going to put our name on a building. Mayo Clinic doesn't do that. When we go somewhere, we really go somewhere. And that's part of our promise to providers and to patients. If you see Mayo Clinic, you get Mayo Clinic. So I can talk about all sorts of individual achievements over the last year with SSMC. The fact that we opened a 742-bed hospital half a world away, and many first achievements, the first spiral endoscopy, virtual visits in SSMC, lots of firsts that we've done. None of that is as important as two things. One is our relentless pursuit of integrating SSMC, so our facility in Abu Dhabi, with Mayo Clinic in every possible way. Treatment protocols, when you pick up the phone, how we pay people, how we reward people, how we build a culture, how we make every patient feel like they are the most important thing in the world. That, I think, has been the biggest achievement over the last year. And it hasn't just happened by accident. And the journey is still ongoing. We've done it deliberately, including the talent that we've sent over to SSMC. If you look at the people we've hired at SSMC, either de novo or that we've sent from the US, these are people who are senior top Mayo Clinic leaders. And that is how important it has been for us. And we have now tasked them to make sure that SSMC becomes a fully fledged Mayo Clinic in every way. I think that's the biggest achievement. And again, we can go through all the other not so small achievements, like I mentioned, the number of patients we've seen, the many, many firsts, but none of that is as important as the culture that we've taken half a world away.
Yes, I had the joy and privilege of traveling to Abu Dhabi prior to COVID happening earlier in 2020. And I was amazed at how the blending between some of our Western medicine and ideas and the incredible respect for the culture that we have maintained, even our individuals who've gone to work there and respected that. And it was a really neat thing to see.
Yeah, you know, I forgot to mention that when they had a peak in COVID in, I think it may have been April or so of last year, Mayo Clinic in the US sent 91 people to help them. We put the word out that they need help, and in no time we sent 91 people on a jet halfway across the world to help them. And it was just, it's too amazing to even describe. They were welcomed with open arms, and everyone from Mayo went there, commented on the friendly culture and how much they learned as well. Remember, wherever we go in the world, the learnings work both ways, right? We go there with humility, and we, in keeping with the Mayo tradition and what the Mayo brothers did, is we don't only go to teach and cure people, but we also go to learn.
Yeah, I'm really glad that you mentioned that. I had several colleagues who have shared with me how incredibly meaningful that experience was for them to spend time there, and how much they learned from the experience that impacted them greatly as they came back here to practice.
Pleased to hear that.
Now, Anton, you know, the Middle East is a little part of your job. It's much broader than that. What are some of the current international healthcare issues and crises that are on your mind?
It would be a mistake not to mention COVID, and not just the immediate pandemic and the lives at risk and the people we're trying to help, but the bigger impact that it has and what it is teaching us about healthcare in general. In ways it's making us innovate and really think totally differently about healthcare. But outside of COVID, there's some major shifts happening in healthcare across the world, some of them because of our own successes as a worldwide community. And what I mean by that is that we have a real problem with non-communicable diseases. So as societies improve and become more sophisticated, they have access to more money and richer diets, and new problems start developing, and that is that we become victims of our own success. So that is things that happen with longevity, like cancer, coronary artery disease, diabetes, all those type of non-communicable diseases is a big challenge for us worldwide going forward. Not to downplay or underestimate the ever-present communicable diseases that still occur all over the world, but non-communicable diseases are growing in leaps and bounds. And then as that happens, and there are more and more cures and treatments available, the challenge is how do you pay for it? And how do governments and private payers and individuals pay to help them with their problems, which again are related to our successes as a society. And as we have more communicable diseases and we have to try and figure out how to pay for it, the other big thing that's happening is all the new healthcare innovations that are occurring. We're only just beginning to see the discoveries and benefits from mapping the human genome, and all the fantastic drugs that are coming from that discovery. We're really just beginning to see that. which again brings us back to how are we going to pay for this and how are we going to get this to as many people in the world as possible.
Anton, what do you see as Mayo's potential contribution or even responsibility or role in working on some of the issues that you mentioned?
You know, Elena, we both work at Mayo, and I think you'll agree with me. This is the place where you go to for a definitive answer. And it's a humbling experience and a big responsibility on our shoulders. I'm seeing patients in the pancreas clinic this week, and every patient I see, I have to remind myself that there is nowhere else for the patient to go after Mayo Clinic. And that brings us back to our responsibility to cure, connect, and transform, which is our 2030 strategy. Said perhaps less formally, our place in the world is the definitive answer, the trusted source of knowledge for patients with serious or complex diseases. I'll tell you a story just to make that a bit real. Like most people, I'm on WhatsApp, and I've got friends in South Africa where I grew up. Well, 2 days ago, I've got a little group from my university friends. A whole bunch of them suddenly have COVID. And they all comparing notes about what they should do. They're all physicians in different specialties. And as I watched the discussion, which was about 20 or 30 different WhatsApps because their time zone is ahead of ours, it just dawned on me again is that they were looking for a definitive answer. And they were all comparing notes. This is what I used, this I looked up this from this place and that sort of thing. And I think that theme we see all over the world. Where do you go for the definitive answer and trusted knowledge? And that is what Mayo Clinic provides to the world.
That is really amazing. That's a neat example. And I'm wondering, is this a project or sort of work that Mayo takes on its own, or how do we work with others in order to enhance what we are able to provide?
No, we've never wanted to do it alone. One is that would be kind of lonely. And the world is far too interesting with too many diverse and wonderful people to share knowledge with. We do not want to do it alone. And frankly, I don't think we'd be successful. When you look at how Mayo Clinic International is going about it, we do this with partners. Every country is different. Every country has sometimes genetic differences in how people react to diseases and how they respond to treatments. And then there are cultural differences. So we do this with partners. And Mayo Clinic always has. I mean, I take us back to the Mayo brothers. The Mayo brothers did 40 international trips before modern transportation in their lifetimes as they looked for partners and ways to share knowledge all over the world. We'll do this with partners. That's the only way to do it.
Anton, as COVID is transitioning now to a vaccination phase, and we expect to see that spread throughout the world, hopefully in the next months, what does this mean for healthcare on an international scale? A lot of, our work has been paused or slowed a little bit as far as sending our ability to send workers out and to have patients come here. How do you see the vaccination changing our direction?
Well, firstly, regarding the vaccination, I know you share with me the immense respect for the scientists or science as a concept that has come up with a vaccine in less than a year. I mean, wow, right? Just think about that. And the journey's not over yet. We've just started the vaccine rollout. As that starts taking hold, I hope and pray, and we all anticipate that our lives will return to normal soon. Whilst COVID has been hitting us, we have to remember that people are still getting other diseases, other infections, coronary artery disease, diabetes, cancer. And we can't stop caring for those people and worrying about those. And frankly, that's what we've been doing internationally during the COVID crisis. The beat goes on for all the other healthcare needs that people have. What I'm looking forward to, though, is as COVID settles down, and my goodness, I hope that soon, we can accelerate our international work in all the ways that I described to you earlier. We are not waiting. We're getting ready for it. In many ways, we're still doing it. We just want to accelerate it much faster once we can all travel again.
I'm glad that you mentioned what you said about other diseases, because we have tried on this program to encourage listeners to be aware of other healthcare needs that they would have in the midst of COVID. It's not a time to forego cancer care, for instance. So that was a great example to give. I'm wondering, Anton, how do you see that Mayo has contributed to the pandemic itself? You mentioned earlier the incredible accomplishment of developing a vaccine in less than a year and rolling that out and beginning to vaccinate the population. How has Mayo contributed?
I think the main way has been to become, like I said earlier, the source of trusted knowledge. We've got over 4,000 physicians and scientists, over 70,000 employees who wake up every day with a single mission, and that is to treat every patient like they are the most important thing in the world, and that includes patients with COVID. So we've become a trusted source of treatment guidelines, treatment protocols during the COVID crisis. You probably remember early on in the crisis, the world was crying out, who do we look to? And there was a lot of distrust in various countries on the governmental information sources as well. And sometimes those places just didn't have the knowledge. So I think we've provided that. A lot of thought leadership and treatment guidelines for the world. We've obviously seen many patients. We've expanded our virtual healthcare capabilities dramatically. And then we've been on the cutting edge and a global leader in various research protocols, including things like convalescent plasma for patients with COVID. So we've been in the thick of it, and I'm very proud of the organization in the way we've stood up to be a global trusted source of knowledge during COVID.
Switching courses a little bit now, I'm wondering what you would say, Anton, to our listeners who might say, why is Mayo concerned with moving internationally? I myself have family members who can't get appointments at Mayo Clinic. There are lots of healthcare issues within the United States that we could be working on. Why isn't Mayo expanding their care within the United States instead of moving internationally?
Well, firstly, Mayo Clinic is expanding its care in the United States. And we've never seen this as an either or. The world has become a much smaller place with modern communication and modern technology. Remember, taking Mayo Clinic to the world, and I stress what I said earlier, is taking it to the world in new dimensions. This cannot be at the expense of the local patient. It's in addition to. And I'll stress something that I said earlier as well, and that is when we take Mayo Clinic to the world, we also learn. And those learnings come back to help us treat local patients. And I do really mean that. Every single day, we learn things overseas. The world is a big place with a lot of very clever people who can help us find new ways to cure and treat patients. I frankly think we've got a moral obligation to take Mayo Clinic to the world. And we will never do that at expense of our local patients, however.
And we'll never do it if we wait until there is no need for healthcare within the United States either. So working on both of those in tandem, I can see is very valuable.
Agreed.
Anton, I'm sure that our listeners would be fascinated, and I would too, to hear a little bit about your personal journey and your career path that has led you to Mayo Clinic and how that influences the philosophy with which you lead Mayo Clinic International.
Yeah, the question's quite a deep and soulful one. Just very briefly, my journey with Mayo starts when I was a medical student. It was a 6-year program. In my 4th year of medical school, I was frustrated by the inefficiencies of the system, the clumsiness, the lack of communication, you name it. And I come from a healthcare family. Both my parents were doctors, for whom healthcare was a true vocation and calling. And I said to them one evening over the dinner table, I said, "Is there nowhere in the world who's figured this out? I'm losing my mind." And they said, "Well, there's this place called the Mayo Clinic." And that's the beginning and end of my story. And then it was just a matter of how I was going to get here. I came as a visiting medical student. I worked as hard as I possibly could to get a spot, and I came in as a resident and worked my way up. So what does that mean for Mayo Clinic International? At the end of the day, with all those fancy things that I mentioned to you that we're doing internationally, nothing really matters more than taking care of an individual patient. And as you know, the Mayo mission is that the needs of the patient come first. I experienced that when I first came to Mayo personally, and I've seen it in our work internationally. When I came to Mayo, one of the first things I had to do was to have an employment physical. And I had a chest X-ray as part of that physical at about 5:30 p.m. on a Friday evening. The technologist, the radiology tech came out and told me that they saw a little nodule on my lung.
Oh, wow. How frightening.
And I'm a physician, right? So I know what that means. I think about it, 5:30 in the afternoon, outpatient clinic, most places are closing down. And the radiologist himself came out to talk to me, and he said, "Anton, we can't let you go through a weekend being worried. I'm not really worried, but let's confirm that this is nothing to be concerned about." And they went on to do further testing to get to the bottom of it before the night was done. And they were all there working on me until about 8 p.m. because they didn't want me to have a bad weekend. That was my first true exposure as a patient to Mayo Clinic. It turned out to be a absolutely benign lesion in my lung and nothing to worry about. And I've seen this in Mayo Clinic International. In our presence in London, a few months ago now, one of our physicians was seeing a patient on a Friday who needed to know whether or not they had COVID so that they could get on an international business flight the next morning. And they had a few other things going on. That physician, Dr. Kapoor, was there until 11 p.m. on a Friday night to sort out that patient.
Isn't that something?
So that's the Mayo model of care, and that's what we're doing internationally.
That's wonderful, Anton. I love that you shared that story. I'm always surprised when patients will say, "Oh, I can't believe, you take such good care of me." And I say, well, I hope that you would take the same care of me. Were we sitting in different chairs? Sure. And I do think that there's something very special about the Mayo Clinic and how we provide care. And I think the incredible stories that we all bring from various corners of the world and mesh here and work together. I think that's really fantastic.
Absolutely agreed.
Well, Anton, we so appreciate you being here today to share some of your story and share with us about Mayo Clinic International.
Thank you, Elena. It's been my privilege. Thank you.
Yes, it's wonderful today to have Dr. Anton Decker, the president of Mayo Clinic International, with us here to share what Mayo is doing throughout the world. I hope that you learned something today. I know that I did. We wish you a wonderful day.
Mayo Clinic Q&A is a production of the Mayo Clinic News Network and is available wherever you get and subscribe to your favorite podcasts. To see a list of all Mayo Clinic podcasts, visit newsnetwork.mayoclinic.org. Then click on Podcasts. Thanks for listening, and be well.